And good afternoon. It's another Thursday. Welcome to our weekly chat on your mental health during COVID-19. It's part of the Mental Health Initiative at WBFO with support from the Patrick P. Lee Foundation. Today's topic, older adults and isolation. Ursuline Bankhead is with us. She's a psychologist. She specializes in geriatrics. She works with the homebound population through the VA Medical Center. We are ready to take your comments, your questions, anything you'd have to offer. We want you to be part of this, so you can just type it in here on Facebook, and we'll get the comments to her as the program unfolds. Giving you a chance to do that, though, I've got a couple questions I want to start out with. And Ursuline, thanks for being here. With COVID-19, we know that older adults are a segment of the population that is at a greater health risk. How does that risk factor have an impact on their mental health?
Well, so what happens is there's always a connection between mental and physical health, right? So, several studies about it, but when we look at older adults who are often a marginalized population, in addition to now being isolated, we're looking at things like depression, increases in anxiety. Um, if they have cognitive impairment, we may see even more confusion. So we can see several different types of mental health issues, some that are exacerbated and some that are emerging as a result of illness, chronic illness, and now social isolation as a result of this pandemic.
I can imagine that fear has got to be one of them. To some degree, fear of getting sick, fear of dying, just fear of the unknown. Fear, to my mind, and you're the expert, is probably the biggie.
Yeah, definitely. So, one of the things, I've worked in geriatrics for several years now, and one of the things to consider is sometimes it is certainly the fear of dying, but very often it is really the fear of how they're going to die. And with the information from the news media right now, what we see is, will I die an uncomfortable death? Will I die alone? Will my family be able to be near me? And so when I'm thinking about the population I certainly have worked with, men and women over the years in chronic illness and the elderly, very often people have a very Rockwellian ideal of how they want to die, with family around them, feeling loved, feeling secure. And so there's an increase of fear, certainly around illness, but again, the process now is frightening, certainly some of our patients around how will this play out for me. One of the things that research has shown is that older males tend to be at higher risk for suicide. In other words, depression, anxiety, leading to suicidal actions. So when you are looking at that particular population, and I know we talked about this in a previous discussion. One of the things we don't want to get trapped in, one is we know they're at higher risk, but the other thing we want to be really aware of is to not assume that an older male is definitely going to be depressed. So when we're looking at the mental health, it's a little bit different. We're looking at issues such as loss, over generations. So if we are looking at someone who is 70, 80, 70 is not old to me, but let's say 85, 90, 95 years old, or someone who's chronically ill, there's a good chance that they've experienced the loss of family members, of friends. So there's this history of loss that can be somewhat depressing for them. When we're looking at children moving away, we're also looking at, when we're talking about things such as depression, we're looking at a lot of people feeling as though they don't have a purpose. And so when you have that and you combine it with a situation such as the one we're in, um, I don't want to be melodramatic and say we're creating a perfect storm, but we're
Hmm.
creating a situation that can or will enhance depression, or even enhance a greater sense of isolation and anxiety, right? Anxiety about what's going to happen to me because of my physical illness, what's going to happen to my loved ones, if they're also aging as well.
So you talked about isolation. How do we deal with that? Is that just a matter of being in touch? Maybe using, and we talked about this while you were away from us, maybe using technology to try and connect with people. What are your tips? Should I call someone on the phone, or should I stop by and maybe stand on the porch with my mask on? What do you think is the things that people should be doing right now that they probably don't know they should be doing?
I think the things you mentioned are great. I think that yes, if you can come by and you can stand on the porch, I think if you have a loved one who's in a facility, such as an assisted living or a nursing home, and if you can coordinate with the facility to bring over a tablet or a computer so that someone can FaceTime, so schedule a date, with your loved one. If you see on the internet, very often people will stand outside with signs saying, I love you, and waving for
Yeah.
our seniors to make sure that they're feel valued, or that they know that they're valued. But something that I think can also help, especially if you can't get to where they are, is I'm a fan of letter writing. So the
Mm.
telephone is certainly one way, an old fashioned way, and it works. You can be very intimate even on the phone and asking questions, writing letters, sending cards. These very supposedly small gestures mean an awful lot. But something, even when we're communicating with our seniors who may be isolated, is how do we communicate with them? So it's not just, hey, dad, how are you doing? It's, tell me about your day. What's been going on? What how did you handle this in the past when things have been hard? Give me some wisdom. So it's
Mm.
really pulling from our seniors, not just a closed, answer, a yes, no. Oh, did you have a good day? Yes or no. But it's really saying, let me elicit a response from you. Let me find out
Spec-
more from you. Mhm.
Specific engagement, not just how are you, but tell me about your day.
It's specific and intentional, you know.
Mm.
So not just did you have dinner, but what did you eat for dinner? Oh, was it good? Has the food at the place gotten better? Oh my gosh, you've always hated those mashed potatoes, are
Yeah.
you still eating those? So yeah, so it's really engaging. And one of the neat things is we can learn so much about someone from that engagement.
One of the risks maybe with say a neighbor, more than a loved one. If you know the person, I imagine this isn't as much of an issue. But I can also see, if I'm not aware of what I'm doing, I could end up talking down to them. We don't necessarily take the elderly as an important part of our lives. Um, I can picture conversations becoming a little patronizing. Talk to me a little bit about the infantilization, if that's a word, I think it is, of this population, especially in terms of how we would communicate with them.
So there's actually, so I'm a nerd, so there's some research, right, that tells us specifically that when we talk down to seniors, that they actually lose some IQ points, right? So when we're communicating, such as, hey, how's your day been? Even our tone carries a lot of weight. So if we, and forgive me for doing this, and we're talking to them like they're a child, actually, we can make them more upset, make them feel more devalued. We can increase depression. So I strongly encourage people, whether it's healthcare providers or just the neighbor, the family, whomever, to really talk to the person as though they're talking to another adult, because that's exactly who you're talking to. My
The part of
grandmother.
what the part of what you just said there that was most interesting to me, obviously talking down to them is not a good thing, but it actually reduces their IQ.
It actually, we have found that they score poorer. It's not really their IQ, but
Wow.
they actually perform more poorly on cognitive assessments when we talk down to them.
Hmm.
So if I interact with them normally and say, hey, I really need you to do this, or tell me about your day, and I give an assessment, they'll score one way. And then if I talk down to them and I do that infantilize, and I can't say the word anymore, but if I talk to them as though they're a child, or as though they truly can't comprehend, they actually score even lower.
Hmm.
So there is a true consequence and a true cost to even how we speak, how we interact with. And this holds true whether the person has a cognitive impairment, such as a dementia, or whether they don't have any cognitive impairment.
All right. Is there a particular way we need to talk about risk? Risk is scary. We talked at the top of the conversation about how fear plays a role. How do we even address risk?
Certainly. So, but I think it's how, again, it goes back to how we address risk. So instead of saying you're 75, so you're likely to die, which I
Yeah.
think is the message that's out there, what we can say is, look, you have cardiovascular disease, and regardless of age, that makes you at higher risk. You have diabetes, that makes you at higher risk. If you have obesity, you're at higher risk. So you have these comorbidities, mom, dad, whomever, that make you at higher risk. So it's not just about being 75. You can be 35, have risk factors, and be at higher risk for COVID or any other disease or illness. So when we're talking to them about risk, we can say, listen, I really want to talk about how can we mitigate risk because your health conditions make you. So it becomes about the healthcare conditions versus about the human being.
It it's something where you don't want to stereotype. Oh, you're going to have illness. You're just old.
Right, absolutely, which is ageism, right?
Yeah.
And so when we're looking at the impact of ageism and we look at, again, ageism and the impact on mental health, certainly is. We're looking at increasing depression, we're looking at increasing anxiety, we're looking at participating in marginalization.
A lot of the stuff that you learn in journalism school is all about communication, and I'm sure in your field too. The idea is communication is definitely something where a message is sent and a message is received. The idea that instead of just asking how are you doing, you got to take it a step further. No, really, how are you doing? To make sure message is received and then something comes back to you. It is it rhetorical question, I know. Is it okay to really probe?
It's fine to probe unless somebody says stop probing. And people very often will say, leave me alone. And if someone says that, you back off. I think, again, it's about respecting someone's space. So how are you doing? How was your day? And if they give you an answer to a point, that's fine. And then you move on. Um, but it's again about respecting someone as another human being and certainly as an adult, where they can say, I don't want to talk about this. Um, you know, One of the things that I think maybe I want to toss out there is that seniors are talking a lot and seeing a lot about COVID. And so that sometimes will shape all of our conversations. And I know from a mental health perspective, what I'm encouraging people to do, my patients certainly, is turn off the TV. You know,
Mm.
I'm telling them watch one news show and then turn it off. Odds
You're
are
allowed
nothing.
to listen to public radio, but turn off the TV. I'm just
Exactly.
kidding.
That's it.
Okay.
Public
I,
radio, nothing else.
right, right.
Um, but I'm certainly telling them to do that because the more they're watching and consuming, this is true for all of us, but the more they're watching and consuming it, the more anxiety it's creating. So even when we have our conversations, that communication, one of the things we can do is say, you know what, we've talked that to death. Tell me about something else. Let's talk about something new, something interesting, something from the past, your hopes for
Yeah.
what you want to do when this is over.
I think that's probably also a good idea because it gets them beyond the stuff where they're apt to say, "Oh, I don't want to be a burden. No, I don't want to talk about that. It's none of your concern. I'll just deal with it myself." Getting them over that hurdle.
Well, and it's certainly also communicating with them that they're not a burden, right? And, right now, elderly very often feel as though they're a burden, even if their families don't. So it's not saying, oh, dad, I'm going to go to, what do you need? I'm going to the store and then I have to do 37 other things. It's saying, hey, I'm going to the store. I'd like to pick you up some ice cream or something, a favorite, whatever. Would you like me to grab it? It'd be my pleasure to do it, you know. So it's again shaping the conversation so someone doesn't feel as though they are a burden. It's making them inclusive, so instead of saying, no, 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 I'm not going to get you that because it's bad for you, it's, let's talk about some alternative because, I love you and I would love to have you around for a lot longer, dad, dad,
Mm.
mom, whoever. Um, but very often I find seniors feel as though they're burdens to their family.
On the other side of that equation,
Mhm.
do the caregivers, the family members, feel burdened sometimes?
It certainly depends on the family, right? So some families absolutely go, "No, this is what I want to do, and I love doing this." And most people fall in between, where they go, "I'm still working full time, I'm taking care of 20 things." And it's the task, not the person. And I think that that's a really important distinction is that
Say that again.
the
What do you mean
task.
by that?
What I mean by that is that there's so many tasks in modern life where going to work is a burden, even if you love your job. For many people, taking care of your children can be a burden, even if you
Mhm.
love, hopefully, you love your kids. Um, but the person themselves, so mom, dad, auntie, whomever, is not the burden. It is the tasks of just living and going through the day that can become overwhelming versus the person, him or herself, is not
Sure.
necessarily the burden.
Okay. We're well enough into the program that I'm guessing, hoping, and thinking that those who are along the journey with us have comments. If you'd like to share a story, we'll do that here on the program. If you have a comment or a question, just type it into Facebook. That's the kind of interaction we're looking for. We'll relay the question to Dr. Ursula Bankhead. We'll get you your answers, and we will all learn from this. A quick recap if you're just joining us. It's part of our weekly series on your mental health during this COVID-19 pandemic. Dr. Ursula Bankhead is here. We're looking, Ursuline, I'm sorry, I'll get it right. You're not from the James Bond movies. You
I
are
am not.
Ursuline Bankhead, and she's with the VA health system, dealing oftentimes with homebound veterans and others. So, this whole topic of isolation, this whole topic of uh, perhaps an older adult, is something that she's got a lot of expertise on, and we'd love to have you aboard the conversation. When I think of older adults in my life, I think of the examples of both my mom and my mother in law. One of them is very active and older and seems to be more engaged in things, and the other maybe a little more homebound and has a few more medical problems. Do the two go hand in hand? Does that weekly meeting for cards or coffee really help keep them young?
Yes, absolutely. So the more engaged someone is, the better their mental health. And if they're moving around, obviously their physical health. So I always encourage seniors, if you like music, play music. If you like card games, play them, as long as you can. If there are things you can do with your mind, your hands, your body, absolutely. Yoga, is awesome, for very often for seniors. So we want them as engaged as possible because again, they still have active mind, active body.
Okay, but the morning cup of coffee at Tim Hortons doesn't happen anymore. The yoga class doesn't happen anymore. The card game at the senior center isn't
Right.
happening right now. Talk a little bit about that aspect of it, and and can there be any replacement for the lack of socialization that used to be organized activity?
So this is where the rest of us can sometimes come in. So with technology, if we are lucky, you can have again, even if it's a trivia night over Facebook Messenger or over Skype or FaceTime, and families are doing that.
Hmm.
I know a family where the grandmother is local and her grandkids are out of state, and they literally color together, just to keep them connected and engaged. So I think it's replacing it to some extent with other things. So you're saying, okay, well, what activities can we do remotely? Let's schedule. This is when those scheduled, phone or internet dates is really, really critical to say, what, every Tuesday or Thursday or Friday at 2 o'clock, this is when we're going to meet to kind of have a check in and we're going to talk about politics. We're going to talk about music. We're going to talk about religion.
But to be a little sneaky about it,
Sure.
yeah, I'm having a trivia game, or yeah, I'm talking about politics, but this is probably a really good chance for me to figure out whether they're doing well.
Absolutely.
Um, a check-in that's not really a check-in, ostensibly.
No, it's really a conversation and an engagement. And Absolutely, we want to see how they're doing if they're living alone, especially, right? So if they're living in a senior apartment where people are not checking on them, right? Senior apartment is not assisted living. So in a senior apartment, mom and dad could be there and we don't know if they're eating or not, right? So the question isn't, did you eat? It's, oh, what did you have to eat? How did you make that? Can you tell me how you made that or where did you get it from? And we get a really good idea of, did they really have Instacart delivered? Did a friend go out? Did they really eat steak or did they not eat at all? So we're asking, hey, yeah, hey,
Mhm.
how's your appetite doing? You know, and this goes back to the what did you do today? So that
Yeah.
checking in versus a check-in perhaps would be
You've got to be creative about how you're monitoring them while at the same time you're engaging with them.
right. And to be honest, let's be clear. We're talking about people who can't do. My mom is a senior. She does not appreciate me saying that, I'm sure. But my mom can get out and about. But she does have friends who are stuck at home because of healthcare issues. But yeah, you do have to be sneaky. And I know I'm sneaky with my mom, who is active, all the time. Saying, hey, what are you doing today?
What
Where
what what
are you?
happens on Facebook stays on Facebook. We're not going to tell anyone.
Oh,
Um,
as I go, I hope she's not on right now.
yeah, that's okay. I know my mother's not on Facebook. My mother-in-law is, but my mom is not. So I think I'm safe. You're just going to have to explain that on your own. I'm leaving you up to dry there. Uh, let's talk a little bit about memory issues.
Sure.
If someone might still be physically active, but perhaps not as sharp as they once were, talk about communication issues that are different when someone is having memory issues.
So, very often we find that when people have memory issues, we want to make them remember something as we remember it or to remember it correctly. And I tell people we don't need to do that. It's more about the connection. And people with memory issues very often feed more so off of our emotion than the content of what we're talking about. So if I come in and I'm with, this is a generalization, but if I come in and my mom or dad, is there and I come in anxious, it is very likely that I'm going to transfer that sense of anxiety. Or if I'm angry, they may feel angry or depressed because I'm giving them my emotions. So the interaction
Oh,
that,
there we go.
oh,
Yeah.
okay,
Mhm.
so
You just froze for a second. I don't know if everyone didn't hear you, but I didn't for just a moment.
okay. So I don't know what part you're, but so what I'm saying is that really the emotions we have really go towards other people. So if I'm depressed or angry, the person who has a cognitive impairment is going to pick up on that emotion and will respond in some way to that. If I come in and I'm relaxed and I'm kind of loose or I'm happy, I'm more likely to get a better outcome. So they may also be responding to COVID, so even on the phone, and they're like, oh, there's this disease that's out there. And you may say, well, yeah, there is, but you know what? Let's rephrase it, let me redirect you. And we're going to talk instead about, yeah, that's out there. Everything will be fine. So remember when we were at the beach that time. And so you're
Mhm.
redirecting to
Okay.
something much more pleasant.
All right. Some questions and comments are starting to come in. If people would like to add to the ones that are already here, just type them up on Facebook. We'll get there. Celia is writing in. She says, friends have told me their older parents are refusing to stay home. In one example, a woman in her 70s is going every day to Wegmans to get a cheese Danish. How would you respond?
So how I would respond is you can fight with them, but you are going to lose, right? Because they can get there. So instead of fighting with them and knowing that you're not going to win the fight, what you can do is say, hey, would you at least for me just wear the mask? I know I can't make you stay home, but I really don't want you to get sick. And I really, so how can we make this work where there's a compromise? And so having that type of conversation is better than saying, well, you can't go because they're going to go anyway. So it's redirecting them yet again to, I love you. Can you please do this?
Okay. Also, hey, I'll pick up a Danish for you. I'm going to the store anyway.
You can certainly do that, but my guess is that they're going to go to, the hardware store if they're going
Okay.
out every day.
All right. Talk a little bit, and we got into this for a moment, but then I think we wandered, and that's okay. That's what conversations do. Talk to me a little bit about danger signs. Someone used to be a big eater, now they're only a picker. What sort of red flags should I be looking for to make sure that this person that I care about is getting everything they need?
So some things that we're looking at are changes in behavior, right? So you mentioned one, which is appetite. So someone was a big eater, now they're a picker. If someone who's normally in a good mood is suddenly gregarious, is suddenly very quiet, very reserved, is giving you one word answers. So you're looking for changes in behavior. If someone who was very sharp is now very confused. If someone who was very calm is now very angry. If someone who was outgoing is getting more and more withdrawn. These are really some danger signs that they are experiencing some depression. Now, something else may be going on, but we're looking at a change in mood that may
Uh,
mean that we need to ramp up even more of our attention for them or towards them, or to say, hey, you know what? I just want to make sure everything's okay because, you're important.
and in a large part, I'm guessing the advice there is that good can come from bad. That this whole experience can actually reinforce some stuff that we wouldn't have otherwise known.
Absolutely. So here's the great stuff. We can learn history. We can learn about personality. We can learn new skills. We can actually just in the exchange, if we can make an exchange with someone who's isolated, someone who's a senior, a positive one, right? Something good can come out of it. We now have time. This is kind of the interesting thing is right now we have an excuse to make time to spend, even if it's remotely with someone. And there's a lot of great things, family history that can come out of it. Family secrets come out all the time. That can be good
Mhm.
or bad.
Yeah,
So, I'll leave that one alone. Um, but yeah, but everything from recipes to how to fix the car can come out of this. And so I think we can use this time, as stressful as it is for everyone, really as a strength and as a way to connect. And I think that connection is really what we're looking for right now.
I like that. The idea of storytelling. One of the things I do on the side is genealogy,
Me
and this is
too.
the perfect opportunity for that, to just kind of engage folks a little bit more in that regard.
It is, right? Because people, one of the things I think about, my grandmother always said, I wasn't born this old,
Mm,
so she had a lifetime before her. And certainly my job at the VA, I get to see pictures on walls from when my veterans were young, so I am blessed in that way.
yeah.
So I find that pretty fascinating. But getting the story, right? Person's more than a birth date and a death date. They're the stories that make them who they are.
Hmm.
And what a wonderful opportunity to say, oh, this is why they act this way, or this is why we do this tradition. So I think it's just a wonderful way, a wonderful
Yeah.
time and
Yeah.
way. Yeah.
I especially like what you said there about just the birth dates and death dates. Ancestry.com can give me that, not a commercial. They can give me that, but the stories, oh yeah, your grandfather always wore his cap off to the one side. That kind of stuff is really cool. It's really interesting. We do have just a little bit more time. If there are folks out there that want to share more comments, we're certainly welcome to do that. You're welcome to do that. I did though want to go back to one thing from earlier. You talked about the different conditions and the different ways we should necessarily approach someone. What if your loved one is in a facility? What if you can't necessarily see them?
That's when I would definitely call the facility and say, how can we do this? And I would collaborate with the facility, understanding that they may be overstressed, overburdened, but say, when is a good time to FaceTime with, my loved one? You know, if I stand outside with a sign outside their window at 3 o'clock, can you have them there while I wave,
Yeah.
a hey sign? And will you work with me to make sure that that happens? Um, so if they're in a facility, again, that's another time. I know I've done it. One of my girlfriend's moms is in a facility and she said, hey, can you guys just send letters or cards to my mom? Gladly, we did that and it made her mom feel so. So I think it's collaborating with facilities. I think it's being really creative. Sending a message in a bottle. You can buy those at Michael's. No plug for them either. And again, stick it in the mail. So I think that there's a lot of ways. Drop
Yeah,
off cakes or cookies and say, "How can I do this?" For them.
exactly. Want to ask you about how you're celebrating Mother's Day?
I have no idea.
Okay.
So I don't
Because
know.
when you talked about gathering outside the window, my sister is organizing a schedule. It'll all be social distancing. It'll be outside if it does not snow, um, and family X will be there from 1 to 2, family Y from 2 to 2:30, and so on. Still allowing the social distancing, still allowing space for the lawn chairs outside, and still making sure that each person basically gets a chance to be there without all of us being crazy together in one big room. Um, I'm not offering that up for you to maybe weigh in with your expertise, but I bet you have other scenarios that are similar to that. What's on your list of ideas? If if you haven't thought about Mother's Day yet, nudge nudge, wink wink. How would you do it in the context of all the other stuff that we're talking about here?
Well, so some of the neat things I've seen is you have caterers who are, delivering meals to moms. So you can have a caterer do that, especially if you live distantly, where this is a new service. We never used to do this. You can certainly have balloons sent. You can decorate their yard, with, you know, balloons and posters and so on. You can sing a song. You can serenade your mom. No matter
Oh
how,
no,
my mother would not want me to do that. Um,
exactly. You do not want to hear me sing.
Me neither. Actually, I may do this to my mom now for fun, but you would never, but you could have people outside serenading and singing the song. Um, so it's really about being really creative. It's not about talent or any of that. Who cares? It's really saying, okay, well, what can I do to let this person know I'm really thinking of so you can bake for them and drop off homemade bread at the doorstep, or cookies, or I always go back to food, but you can do any of
I don't blame you.
that. You know, so it's really just kind of getting your claws into saying, okay, what would my mom appreciate or my dad, because Father's Day is in June, what would my loved one appreciate and how can I socially distant do signs, do a drive by like they're doing for birthdays now, honking of the horn saying, I love you. So I think if we can convey that message, I think we've done a pretty decent job, even if it's from afar.
How do you, obviously it's your field, so some of the references you have might not be universal for a lay audience, as it were. But how do you keep up? What sort of resources can you share that someone needs to know about? Is there a particular website? Is there some place they can gather more information about this? As we wrap up here, what do they need to know? Where can they go to get it?
Okay, well, so some basic ideas certainly are if someone has cognitive impairment, Alzheimer's Association is a really, really great source, for tools and tips and so on. Um, if we're looking at community resources, Erie County or Niagara County Senior Services will sometimes have things going on, as far as resources and ideas. Sometimes a quick Google search, how can I, if you Google social distancing celebrating Mother's Day, I am sure somebody has already created that website. If not,
Mm.
I may do it this afternoon. Um, but if we're looking at the things I do, they tend to be peer reviewed stuff,
Yeah.
so right, so in the literature and in the data. But I really think if you can almost consider what would I do for a child's party and say for that, or if your mom likes wine, do a wine basket for your mom, stick it on the porch, and some glasses. But as far as resources, I think you can just really talk to people. People are really creative. You can Google things. People are creative. Alzheimer's Association is great if someone has impairment. If they're in a facility, you can also say, hey, you're around my mom or dad a lot more. What do you think would be kind of special for them because you see them in a different context? So you're looking at human resources versus internet or other types of resources like that.
All right. And my last question might even be an unanswerable one, but I'd love to get your thoughts. What does the future look like after all of this?
So unfortunately, I think even after everything's opened up, I think we're going to see, I don't know if that was, we're going to see some residual anxiety in both caregivers as well as in seniors. So I think we probably have a while of still working on mental health issues, looking at anxiety, looking at depression, looking at things such as insomnia, and addressing that a little bit better because we're seeing that pop up as well. So really looking at helping people cope to what is going to be a new normal and adapting. So I think that's across all age groups from children through to seniors. Um, that's the negative part. I think the positive part is if we do this right, we can see better connections occurring. And I think that that's really the part we can focus on because it'll mitigate, some of the anxiety, some of the depression. Um,
Sure.
yeah, I think we just have a great opportunity, but I would anticipate that we're going to have a time period of adjustment, and adjustment is really hard. It's really challenging.
Hmm. Dr. Bankhead, this has been fun. Thank you so much for doing this.
Thank you for having me. It was fun for me too.
Glad you were able to. As long as I'm saying thank you, there's a couple people behind the scenes that I need to mention. Producer Lynn Bader, Matt Sanfilippo is here. Social media coordinator Johnny Moran is also helping out. Our mental health initiative at WBFO is brought to you with the support of the Patrick P. Lee Foundation, so we do have to thank them as well. Before we go, I want this to be a regular thing. Put it on your calendar. Next Thursday at 4, we're going to do another one of these. The topic today was older adults in isolation. Next week, it's what do the healthcare workers or the essential personnel need to know? How can we help them deal with some of the mental health issues that they're facing? So we hope you join us then. As always, we want to make sure that you're able to comment and share your stories here on Facebook. Thank you for those who have done it so far, and we'll see you again next week, every Thursday at 4, here on the WBFO Facebook page. That's facebook.com/WBFO News. Thank you.